here for the Harford County Office on Aging. I work part-time. There are 2 other employees in our program. They are also part-time. So we run kind of a, I don't want to say skeleton crew, but there are not a lot of us, but we do manage to get quite a bit done. And we are just sort of in the process of gearing up for open enrollment. So I have a short presentation just to give you a few updates of things that have been going on with the program, some updates about things that we offer. And of course, you know, I'm happy to answer any questions that you might have that would pertain to how you might be able to help. So let me go ahead and share my screen here. And okay, can you see it? Okay, so I'm not the most technical person, so if I make a mistake here, pardon me. But anyway, so we're just going to do some updates and trending topics for 2021. And again, please feel free to ask me any questions at the end. If there's something I'm not covering that you had a question about, I'm happy to go over that as well. So what is new with Medicare currently? So Social Security Administration, when COVID happened, they pretty much shut down to any in-person appointments or anybody coming into their buildings, which, as you can probably imagine, was a struggle for a lot of people in trying to enroll in Medicare or make any kind of changes to their Medicare accounts or their Social Security accounts. They are currently taking in-person appointments, but they are by appointment only and they're for critical needs. So I don't think it's really open to just anybody to pop in there. So normally what we're telling people is to schedule a phone appointment. I think they are a little easier to get at this point. There was a time when the phone appointments were really far out, but I think that, you know, if they were to call and schedule a phone appointment at this time, it should happen within a few weeks. Most of the representatives that people are talking to are encouraging folks to set up an online My Social Security account so that they can sort of look at their own accounts and maybe answer questions for themselves. There are many forms available on the Social Security site to allow people to do those things on their own. So even just enrollment into Part A or B Medicare, there are forms on the Social Security site that allow folks to do that. I do think you have to download them and fill them out and mail them in with any documentation that would be required, but at least it's available without having to wait on the phone to have somebody mail that to you. So that would be a little update for Social Security. I don't have and actually this would be something that I would put out to anyone in case you do, but I would love to have a contact person at Social Security that we could actually talk to if we had questions that people ask us. Sometimes we can't necessarily answer their very specific Social Security based questions, and it would be great to actually have a contact person over there. So if anybody on this board knows somebody, I would love to have that name. We have seen a tremendous increase in SHIP cases that center around enrollment issues. And I think a lot of this has to do with, I hate to blame everything on COVID, but I really do think a lot of it has to do with COVID because communication efforts there for a while, they were a real struggle, especially things that were coming in the mail. And things were coming late. Information that comes out pertaining to Medicare can be very, very cumbersome, and there can be a lot of confusing information. And I think when folks were attempting to call different agencies to ask these questions, they were not getting through. And so because of that, things were not happening in a timely fashion. And so what we're seeing right now, in fact, I just said this yesterday to someone, I have not had any easy phone calls lately. A lot of the calls that we're receiving are some very, very complicated enrollment issues for people that, frankly, just require a lot of time and a lot of input from several different agencies to get them solved if we're even able to. So if you have anyone coming to you that has these sort of, complicated enrollment issues, please feel free to pass them on to us. And I'm talking about things like people who have somehow missed their ability to enroll in Medicare Part B. If you're not familiar, if you do not enroll in Medicare Part B, as in boy, when you are first eligible for that enrollment, you have to wait until general Medicare enrollment, which is January 1st to March 31st, to then do that. And then your coverage doesn't take effect until July. So for people who are in this boat right now, it's September. They are potentially looking at almost a year of no coverage before they can get into Medicare again. And we can certainly help them do some appeals and things, but in some cases, there's not really anything that we can do. So it is just so important that people do their enrollments on time. So we're seeing a lot of these kind of complicated issues right now. I did just attend a Medicare update meeting Wednesday, and they have done some changes to the Medicare Plan Finder tool. The Plan Finder tool is available on their website, medicare.gov. It is the tool that allows people to look at the Part D, as in dog, prescription plans that are available. They did a huge revamp to the Plan Finder, I think 2 years ago, and they've kind of continued through focus groups to do some updates to that tool. So if you use that tool in helping your residents, clients at all, I would encourage you to go on there and take a look at it. They have done some updates that are great and other ones that I actually don't think are so great, but prior to open enrollment, take a look and familiarize yourself with that just so that you can see where those changes are. And they will continue, unfortunately, to do changes all the way up until open enrollment. Every year they kind of do this. So sometimes even during open enrollment, we go into the Plan Finder and see that they have made some changes. If you are unfamiliar with how to use the Plan Finder and you're interested in learning how, we do have a video tutorial on our website that kind of walks through exactly how to use that Plan Finder. We try to encourage beneficiaries that call us who have some general knowledge of the computer and seem to have a pretty good feel for their needs. We try to encourage them to use that Plan Finder on their own, and then they can certainly call us if they have questions. But if they're able to do that, we encourage them to do so. As far as Medicare Advantage plans in Harford County, Medicare Advantage plans are an HMO style plan that Medicare contracts with these specific insurance companies to offer to Medicare beneficiaries. I am sure if you watch TV at all, you have seen numerous commercials for these types of plans. Typically, we get lots and lots of telephone calls from people because the only part that they hear on those commercials is that this plan offers dental. And because of that, they are ready to sign up today for that particular plan. We only have 3 plans in Harford County for these particular Advantage plans. It's with Kaiser Permanente, Cigna, and just for 2021, Care First came into the county with, I believe, 2 plans. These plans are very specific to not only the state, but also the county. So Harford County's plan choices are not the same as Baltimore County, Cecil County. In fact, I don't even think Cecil County had a plan up until maybe this year, and I'm not sure if they do. But sometimes folks will say, my friend has this United Healthcare plan, and that's the one I want. Well, the only options we have are Kaiser Permanente, Cigna, and Care First. There's nothing wrong with these plans. They can be great for people, but I don't think people really understand exactly how these plans work. So when we get telephone calls about them, we definitely try to explain to people how this would differ from having just regular Medicare. We might get some new Advantage plans in the county. We don't normally find that out until about October the 1st. That's when we'll start to see that we have some new options. Several years ago, we had a plan with University of Maryland that was an Advantage plan, and we had a plan with MedStar, and they left the county. I think this will be going on 2 years. So like I said, these 3 plans are really the only options. There is a special needs Medicare Advantage plan through University of Maryland, but that plan is specifically for folks who are dual eligible for both Medicare and Medicaid. So it's a smaller group of people that would be able to access that type of plan. As far as our Part D prescription plans, and this is what most people will ask questions about as we enter into open enrollment. Last year, they introduced some specific prescription plans that were insulin-based plans. So they were to help defray some of the cost of folks who take insulin and give them some better options. If you've ever worked with anyone who takes multiple forms of insulin, then you probably know that these medications can cost people hundreds and hundreds of dollars a month. So Medicare introduced some cost-effective plans for folks who were taking certain insulins. It wasn't for every insulin. There were only certain ones that had joined on with this, but it did give people a fixed $35 copay for those particular insulins. I did learn on Wednesday that there are a few new insulin brands that have joined that list. But the most important thing to keep in mind with these plans is that if the beneficiary receives any other form of financial assistance, they are not eligible for the insulin plan. So if they receive extra help or the low income subsidy through Social Security, they cannot also then sign up for that insulin plan, which is unfortunate because sometimes their insulin is not covered by the plan. And honestly, even $35, if someone is low income, is a lot of money to spend, especially if they take multiple insulins. So it's not great, but it is at least an option for some people. I think the other biggest thing that we've been dealing with in the health insurance world with Medicare are the Medicaid. I'm sorry, I have a typo here. It should say Medicaid benefits extension. When the state of emergency was announced for COVID, part of what was in that state of emergency is that there was an extension on all Medicaid-based benefits for people who were on Medicaid at the time. And what it has done is it has continued their Medicaid benefits, even if they are no longer eligible for them, based on numerous factors, but one obviously being finances. This extension has kind of continued to roll out as we've continued to move through this pandemic. So the last date that we were given from DSS for the extension to end is actually September 30th. But there's a little bit of a discrepancy there because the state also gave us a date of December 31st. So as of yesterday, I had emailed my contact over at the Department of Social Services to kind of get a little more clarity on this. And basically what she told me is that all of the increases in SNAP benefits, so there was an increase to the amount of SNAP benefits that folks were getting each month. The majority of those will end on September 30th. So you may see that you have some clients that are reporting that their food stamp allotment has decreased starting in October.
Andrea, I'm sorry to interrupt you, just real quickly. I'm getting some messages. It appears your screen is frozen on our end. Yeah, so I'm gonna have you stop sharing and then reshare one more time.
Okay.
And then move your slides around to where you are to see if that helps a little bit. Okay, now I can see it. Can everybody see it now? It was frozen on my end.
Yes. Okay.
Okay, perfect.
I think if I just left it like this instead of in the full screen mode?
It shouldn't make a difference, but I can now see that advancing your slide, so we should be okay now.
Okay, I'll leave it like this.
All right. Okay, perfect.
So specifically, those SNAP benefits will, at least for majority of folks, are going to end that increase. Not their SNAP benefits in general, but the little increase that they were receiving because of COVID. As far as their health insurance based Medicaid, this is where it gets complicated. Some people will see these benefits being ended from here on out, and some people will end December 31st. And we've had some people that have called us to say that they're seeing extensions into April and May. So the long and short of it is, I don't think that there is any real hard and fast deadline for anyone. And that is going to be really complicated as we start to help people. On our end, when people have called us that have transitioned onto Medicare, we have been advising them based on their income for how we always would have advised them. So even if their Medicaid benefits are still in place, we are still advising them to enroll in other programs or look for Medicare supplemental policies, because eventually these benefits will end, and we don't want them to be in a position where they can no longer sign up for certain types of insurance. For those of you who aren't familiar, when someone first becomes eligible for Medicare, they have a very short window of time where they can sign up for a Medicare supplemental insurance policy and be in what's called a guaranteed issue. During this guaranteed issue, the insurance company cannot ask them any medical-based questions or base their rates on those health conditions that they may have. So they're given very competitive rates. When you get outside of that guaranteed issue, you are then subjected to medical underwriting. And that can increase exponentially your cost for insurance, particularly for people under the age of 65 on Medicare. Their options are very limited anyway when it comes to these Medicare supplemental policies. And if they get outside of that guaranteed issue, it's completely possible that they may not have any options beyond traditional Medicare that they can afford. So this has been a very tricky situation for us in trying to advise people, because you're basically telling someone, I know you have all these things for free, but now we're telling you to go pay for something. And for a lot of people, it's like, why am I going to spend money when I don't have to? So it's been a very fine line to walk with people, to explain to them, I know we're here now, but here's where we're going to be. And so, with this sort of strangeness about how these extensions are going to sort of end, it will be more complicated, and it looks like could potentially also coincide with open enrollment, which will be a storm for sure. Open enrollment is October 15th to December 7th. That's the same dates every year. That's when people can sign up for Medicare Advantage plans. They can change their prescription plan. We encourage every single person to look at their prescription plans during open enrollment. Even if they're happy with it, even if they feel like they're spending very little money, we always encourage them to look for it. Current plans will send information to their members, usually around the end of September, beginning of October, letting them know if there are any changes to their plan for the following year. So this is when people need to be looking. Are all of my medications still covered? Have the copays changed? Has the monthly premium changed? Has my deductible changed? That's the types of things they want to be looking at. We work with people every year who have had the same prescription plan for 10, 15 years. And when we do a review for them, we are able to save them hundreds of dollars simply because we're looking for something else. People are very loyal, especially when it comes to certain prescription insurance companies. And also because they just don't want to be bothered with doing the legwork. So we always encourage people. The other thing is that even if someone does not take any medication, they still need to be enrolled in a prescription plan. You will receive a penalty from Medicare if you are not enrolled in a prescription plan. So normally we just tell folks, find the cheapest plan that there is as far as the monthly premium and sign up for it. You may never use it. In the following year, you can do the same thing, but you have to have a plan, because what you don't want is 10 years down the road, you start taking a bunch of medicine, go to sign up for a plan, and then find out that you have this exorbitant penalty that's going to be tacked on to your premium every month. Yep. Oh, goodness. Oh, there we go. Okay. As far as financial assistance programs that are available for people on Medicare, there are some Medicaid-based programs that are very specific to Medicare beneficiaries. Those two programs are called QMB and SLMB. They specifically stand for Qualified Medicare Beneficiary and Specified Low-Income Medicare Beneficiary. These are a paper application. It's the same application for both programs. Once you fill it out, it'll screen you for one or the other. And they are submitted to the Department of Social Services. You can actually fill this application out online, but the application online is very, very, very extensive because it screens for every DSS program. So if the person is really just looking for QMB or SLMB, there is a specific application for that that's much shorter. It is an income and asset-based program. So even if sometimes people's income would qualify them for that program, you still have to look at their assets in order to see if they qualify. Assets are things like savings account, property that you own that you don't live in, any sort of IRAs or things of that nature. If you want more information about the programs or to get an application, I did provide the link. And Tracy, I sent you the slides. So if you wanted to send them out, it would give people those links. And you can specifically see the income limits for both of the programs. QMB is kind of like what I call the Cadillac. That's the one that's going to pay for their Part B premium every month. It covers all deductibles that are associated with Medicare Part A and B, and it covers the 20% that Medicare does not pay. Medicare is an 80-20 system. So when you go and have anything done, Medicare pays their 80% of their allowable charges, and then it would send you a bill for 20% from your provider, unless you have something else to cover that 20%. QMB covers that 20%. So it almost acts as a supplemental insurance between the QMB and Medicare. If someone had it, they really shouldn't see any kind of bills. It doesn't cover prescriptions because that's a whole separate type of assistance, but it does cover the other things. It does not cover dental and vision because Medicare does not cover dental and vision, so QMB wouldn't either. SLMB has a slightly higher income limit, and it only covers the Part B premium. So it's not going to cover the 20%, it's not going to cover the deductibles, but it is going to pay that Part B premium each month. So somebody who has SLMB would still need to look for some other form of insurance to help with that 20%. The other assistance programs is Extra Help, otherwise known as Low Income Subsidy. And this is through the Social Security Administration. This is specific assistance to your prescriptions. Sometimes folks are automatically enrolled in Extra Help based on their income that Social Security can see. So if they're receiving Social Security, they will enroll them in this automatically. This, depending on the level of the low income subsidy, will determine how much it pays. But in general, it helps cover the cost of the prescription plan premium. It can cover all or part of a deductible if that plan has it. And it keeps your prescription costs low. So depending on your level of subsidy, your prescription costs can be anywhere between $0 and $8, depending on the particular medication. Again, I provided a link. This is an online application through Social Security Administration. It's pretty simple. And usually within 2 weeks, they'll receive a letter that says that they received the assistance. If they get the low income subsidy and they don't already have a prescription plan, they will automatically be enrolled in a plan. And they can change it if they want to. One of the benefits of having this low-income subsidy is it actually allows people to change prescription plans once, I believe, a quarter throughout the year, so they're not locked into that open enrollment period. And then the other thing about this particular subsidy is that they do need to, each state has a benchmark, and it's like a price that that they say this is the full subsidy will cover this. So if somebody signs up for a higher priced plan, they may not be getting that plan for free with the subsidy, but they certainly would pay less of a price for it. The last program that is available, well, there's two more, but let me skip to the SPDAP, otherwise known as SPDAP, otherwise known as the Senior Prescription Drug Assistance Program. It's through the state of Maryland. Each state usually has their own form of assistance. This is through the state of Maryland. It has a much higher income limit. I think for a single person, they can make up to $36,000. It might even be 37. It changed just recently. 36 or 37,000 a year, and there is no asset limit, and they can still be eligible for this program. This particular program will pay up to $50 a month for a Part D prescription plan premium, so the monthly cost for having a prescription plan. It does not, however, assist with any of the cost of medications, but it will pay for people to have the insurance. This is being managed out of a company based out of Maryland now. So make sure that if you do give someone an application, that the address in the application is a Maryland address. It used to be from a company in Connecticut. They are very quick with the turnaround time for people to receive this particular assistance, usually again about 2 weeks once you submit your application. And this program as well allows people to change their prescription plan one time throughout the year outside of open enrollment. A lot of times when people call us in the middle of the year and they're in need of a prescription plan and they've missed open enrollment, the very first thing that we will do is see if they're qualified for SPDAP, because if we can get them qualified for SPDAP, we can get them into a Part D plan. So, and usually many people qualify for this particular program. It is a paper application, but you can download it from online and then mail it in. And then lastly, there is a program also through Social Security Administration. It's called LINET. It is a interim-based prescription insurance for people who qualify for the low-income subsidy but haven't actually gotten it yet. And it allows them to get up to 3 months worth of prescription coverage until they can actually enroll in a prescription plan. It can also do an emergency fill of medication for 21-day supply if somebody is in less than 5 days of medication. So we get a lot of folks, and you may too, who call with, you know, their house on fire, they are out of their medications, they can't afford to fill them, they don't have insurance, and you can go right to the LINET site and get in contact with them to get this emergency fill. And then they will screen the person to actually get them enrolled in the low-income subsidy if they qualify for it. So, you know, this program I don't think is that well known. But if somebody applies for the low-income subsidy, they will get a letter in the mail to start with that gives them information about LINET and tells them that they can take that letter to the pharmacy and they can fill their prescriptions up until they actually get their prescription card in the mail. A lot of times people will throw it in the trash because they don't understand what the letter's about. So I normally tell people, if I enroll them in the low-income subsidy, be on the lookout for this letter. It will have information for your pharmacist so that you can actually go get your prescriptions filled before you get your card. So if you're not familiar, there's the website address. You can certainly take a look at their website and kind of keep that in the back of your mind for people that might contact you and need a medication. While I'm on that topic, we do get a lot of people who will call us and they're in need of medication. As far as our ability to assist people with actually paying for their medications, there are some instances where we are able to do that. There needs to be, you know, a pretty significant extenuating circumstance for us to pay for their medications, but we do have that ability here and there to do so. However, you know, typically when someone calls us and they need that, our main goal really is to find them a long-term solution. So, we can help you this month, but let's figure out how we can get some plan in place so that going forward, you're going to be able to get these medications on your own. I'm not sure if there are other agencies out there that do medication, that pay for the medications. Normally, people have referred them to us. So, I think we're kind of the last stop for a lot of people. As far as some SHIP program resources that we have here at the Office on Aging, if you're not familiar, on our website, and we just did a little revamp on our website to get it up to date, we have an online learning library that we started creating actually before COVID. And then we sort of patted ourselves on the back that we had such, insight to do that, because it came in really handy last year. We have several videos on our websites on specific Medicare-based topics. Transitioning to Medicare when you're under 65, transitioning to Medicare in general for people who are aging in or turning 65. We have a specific open enrollment video. We have a video on, it's called Medicare, What You Need to Know, and it talks about different tips and tricks on how you can save money on your prescriptions and other things. So there's a lot of good resources there that we can definitely point people to if they have computer access and they have the ability to watch the videos on their own. And then we have a dedicated Medicare email. It's medicarehelp@harfordcountymd.gov. And for folks who, again, have computer access, they can email us their questions if they're comfortable doing that, and we can respond back to them in email, or we can make an appointment, or whatever seems suitable once we've heard the question. We do get several emails a month to there. And we've started to promote that more and more for people who just have quick questions, or we're able to email them a link or something like that. We have a dedicated mailing list for people who are specifically interested in resources related to Medicare. And we usually send a newsletter out quarterly to them with some information. We send them any updates or any new information that comes through from Medicare that we think would be of interest to them. We try not to inundate them with information, but at least every couple of months we'll send an email out. As far as some educational resources that we have available, we just created a folder that is specifically for people transitioning onto Medicare under the age of 65. The folder will allow them to keep all of their health insurance documents together, and it also provides them a checklist from when they initially start receiving Social Security disability up until they transition onto Medicare, with all of the steps of what they need to do to make sure that all their health insurance needs are in place prior to that transition. We find that a lot of times for folks under 65, when they're calling us and they have questions about Medicare, we're so close to the deadline that it's hard to get everything they need in time. So we're hoping that with this video and this folder, we'll be able to allow them to have several months of lead up time and doing the research and really understanding their insurance prior to everything happening. So we have a lot of those folders. If you have clients that are receiving Social Security disability and they're going to transition onto Medicare in 2 years, I'd be happy to give you some of those folders to give to people. Some of the information would be relevant to anyone going on Medicare, but they are specifically for that under 65 population. We also have a bunch of other educational resources that we mail out or send out to people. We have a magnet that lists all of the preventive care that Medicare covers for each month, as far as screenings and vaccines and things like that, that we can give you. It's like a refrigerator magnet that just encourages people to keep up with that preventive health. We have some fraud-related resources that we hand out to people just to remember them to be vigilant about fraud-related things. So if you are ever in need of any Medicare item as far as an educational resource, please, reach out, and I'm happy to get those over to you. We do one-on-one appointments on a case-by-case basis. That has always been the case. That's not specific to COVID. Last year we did mainly phone appointments for people during open enrollment. This year we will do some in-person appointments. for people who really need it, that don't have computer access, that wouldn't be able to navigate the plan finder on their own. We will do some in-person things for them. And we also do, like I said, phone appointments, or some appointments we'll do by email. For some people, they just need the information and they're happy and able to read through it and sort of do the rest of it on their own. They just need our initial input, so we can do all of that as well. Just some trending topics, things that are kind of on, buzzing around in the Medicare world. There's actually a bill in Congress right now that would include dental benefits into Medicare insurance. I don't know if it'll pass, but my goodness, how great would it be if it did? Because, the dental piece with the older population, or just really anyone on Medicare in general, is just such a missing link. If this ends up going through, it would be the biggest update to Medicare since 1965, when Medicare actually came into play. So fingers crossed. The other biggest trending topic we have right now are scam related issues. And we have 100% seen a huge increase in scam related issues, particularly since the pandemic started. We just had, I would say about a month ago, we had a 2-week period of time where we probably got 15 telephone calls from people who had been victims of this DNA testing kit scam that's been going around. We've had a few people still being contacted about back braces or knee braces. But in particular, this DNA testing kit, we've had some kind of creepy things. We had a couple who not only allowed the kit to be sent to them, but once the kit got to them, the company actually called back and said, we can come out to your home and do the testing for you. And so this elderly couple actually had these people come into their home and do this DNA swab, which, was super concerning, because who knows, once this person got, they got an eye on the couple, they were in their house. But the DNA testing scam is huge, because these companies can actually charge Medicare tens of thousands of dollars for this particular DNA kit, because each particular test that they do for cancer, heart disease, whatever it is they're telling you, they can bill separately for all of those different tests. And some of them can be billed at $2,000, $3,000, $4,000 a piece. So we had, in light of this, we sent out a lot of information to many mailing lists that the county has. We put it on our Facebook page, just encouraging people not to get the kit, not to take the kit if you do get it. And just to remember that Medicare, this is the biggest thing. If nobody remembers anything else, the biggest thing we tell people is Medicare will never call you. Social Security will never call you. They will always, always contact you in writing. They will send you a letter and they will ask you to call them, if you have questions, but they will never call you. So if somebody calls you and says they're Medicare and they are trying to verify your Medicare number, they have your Medicare number. They're Medicare. So they don't need to verify that with you. The other thing we tell people is, if somebody calls and they say they're Medicare, just hang up. And sometimes that's hard for people because they don't want to be rude, but it really is the easiest way to do. They will change their telephone numbers. It can come through from different states. It can be the same people calling you from different numbers. So it's just really important to be vigilant. The other easy thing to do is that when you receive your Medicare summary notices, which you get about every 2 to 3 months, just look through it and make sure there's no strange charges on there from a doctor or a facility that you've never heard of or never gone to. And if you see something, we tell people call 1-800-Medicare and report it. But I think the biggest takeaway really is Medicare is never going to call you on the phone. So if you get a call from Medicare right away, that should be a red flag that that something's wrong. And I think that is it. So if anybody has any questions, I'm happy to answer them.
So Andrea, thank you so much. We do have a question for you in the chat from Dennis. Let's see. It says, Andrea, is PERS considered DME and covered by Medicare? If so, what are the steps a client needs to take?
Was the equipment?
PERS.
What does that stand for?
I'm not entirely sure. Dennis, are you still on?
Yeah, I'm on. Sorry about that. It's the personal emergency response to medical alerts.
Oh, you mean like the button that people wear around their?
Fallen and can't get up.
Yeah.
Mhm.
I don't know about that. I don't know that that's considered DME. I would say DME is more like wheelchair walker,
Right.
that type of thing.
Mhm.
But in general, like on a broader question you had about how somebody would get something covered, the biggest thing to keep in mind with any kind of durable medical equipment is in order for Medicare to cover it, you first off have to have a prescription from your doctor for it.
Okay.
And second of all, you have to use a approved DME Medicare supplier. So you can't just go anywhere and get that item. If they're not approved by Medicare, even with the prescription, Medicare is not going to cover it. And so that's usually where people get into some type of bind, and they get a bill. So a doctor's office should have a list of approved suppliers. If they don't, someone could call Medicare directly and ask. Sometimes it is, depending on the equipment, sometimes it is like a pharmacy that's in your county, but sometimes it's a pharmacy that would, be out of your county or even out of state, and that would have to be like shipped to you.
Mhm.
So just make sure that they've kind of gone through that checklist of, did I get a prescription and am I using an approved supplier? And if that's the case, then it should be covered. As long as Medicare covers it. In terms of the alert, I'm not 100% certain about that.
Okay,
If
great.
you go onto the Medicare.gov website, there is a section on there where you can put in, is this covered? And you can actually put into the search different things, medicines, equipment, that type of thing. And they should be able to see yes or no.
Great, thank you.
Yep, you're welcome.
Great. We have another question in the chat from Lisa Starkey. Hi, Lisa. Is there an age limit for SDAP? I have a patient who is 59 and on Medicare with no prescription coverage.
No, as long as they're on Medicare, they're qualified for any of those programs. Yep. So they could be 30, as long as they're on Medicare. Mm-hmm.
That's great. I think that's all the questions we had in the chat. Does anyone else, this is such an important topic. If anyone has any other questions, I can tell you on a personal note, all of the trending topics that you mentioned, Andrea, have been happening to my mom. She's getting all those calls about braces and equipment and the DNA testing, and she's that person that's too nice to hang up.
Yes.
And will engage longer than she should. It's really terrifying that happens.
Well, and the scarier part about it is these companies that are doing these scams, they are just so smart.
Mm-hmm.
And we also tell people, never answer a question that they ask you with the word yes, because they are many times recording your the conversation, and they can manipulate that recording to say, do you want to sign up for my program? And then take your yes and put it with the answer to that question. So that's even scarier. And that's how people end up getting enrolled in things. And the next thing you know, they're getting documents in the mail and they say, but I don't remember enrolling in this. So we usually say to people, if they say, is this John Smith? Then instead of saying yes, you say, this is John Smith, or something, or just frankly hang up, obviously is the easiest. But yeah, they're very smart. So sometimes people think, but I barely talk to them and this happens. And that's why. So it is hard for older people to be rude, I guess, but it saves you really in the end to just, no, thank you, and hang up the phone.
Mm-hmm. We have a follow-up question from Lisa Starkey. Do you have a one-pager, like a one-sheeter, on how to sign up for Part D to give to our patients that do not have prescription coverage? So like a one-page fact sheet on what to do and how to get started.
So we have, it's funny you ask about that because we just had a meeting the other day about what kinds of things that we need as we are getting into open enrollment. We do have a one-page sheet that we give people that talks specifically about Medicare supplements and such, but we are going to add some information about the prescription plan. So we will, and once we get that updated and ready to go, hopefully that will be here shortly, we can send that out. Also on our website, we do have a copy of like the PowerPoint presentation that we gave out to people when we did in-person open enrollment sessions that literally will walk you step by step through using the plan finder. That is also available on our website for people who probably could do it, but might need that documentation just to show them you did this next step, next step, next step. So that is available. But as far as a one-sheeter, we are working on getting that together.
That would be great. And I see Janet's message is very similar to Lisa's, asking for copies of the slides and the links that you mentioned. So we do have a copy of the presentation so we can make sure that every GAIN member has a copy of this, and all the links are on there on each slide that Andrea provided. And again, this information is just so important. It affects so many of us. Any other questions for Andrea while we have her? And you can unmute and ask, or you can put it in the chat.
I put my email address, I dropped it in the chat. So if I get emails all the time from people who say, I have this client and here's the scenario and that kind of thing. I'm always happy to answer any of those questions or give you any kind of feedback on, what I think about the scenario if you need help. Or find the answers. I don't always know the answer. If it's super complicated, I might have to do a little work. But when I was talking earlier about the complicated situations, we do have access to some ombudsmen that work for CMS that are able to really work these complicated situations from the inside out. And so sometimes we need to do that. We can refer things to Dutch Rupersberger's office, and they sometimes are able to work their routes on helping people that way as well. So, if you ever have a situation you've kind of come to a dead end, certainly send it to us. And, we might just say you are at a dead end, but there are times when we can say, no, we could probably do something with this. So don't hesitate to ask.
Mm-hmm. That's perfect. So Andrea, I'm going to ask you at the bottom of your screen, it'll say stop sharing. And that way we can, the whole group can see each other again.
Stop sharing. Yep.
There we go. There we are. Everyone's beautiful faces first thing in the morning. A couple of housekeeping items I wanted to cover before we